Hello, I am Dr. Priyamvada Shah. I am a senior obstetrician and gynecologist. My special area of interests are high-risk pregnancy, infertility and laparoscopic surgery. I am currently practicing at Cloudnine Hospital, Pimple, Saudagar, Pune. So let's discuss today something called as pre-pregnancy counseling. In a female's life, marriage and pregnancy remains the most important event in the life. So pregnancy has to be a planned event like we plan our marriage. So it is better to seek help and advice before you start planning the pregnancy. Ideally, a couple should visit obstetrician so that they get a correct information what all things they should be ready with before planning the pregnancy. Whenever a couple approaches us, we initially counsel them. We check the history, rule out other risk factors, or check if the patient is already on medication. We switch over to a safer medication which are safer in pregnancy. Also, normal physiological phenomenon, safe days, unsafe days, these are discussed with the couple and then they are asked to focus on the specific time zone when the ovulation is occurring. We also advised to quit certain things which are always hazard to the health, for example, smoking, alcohol or drug abuse. So these things has to be avoided by both the partners. In certain investigations will be advised to the girl as well as to the husband. For the patient, we do check her normal hemoglobin status, sugar levels, B12 D, because if she is deficient in vitamins, the next challenge, which is pregnancy, cannot be tackled very easily. We try to rectify all the deficiencies before the pregnancy is planned. Also, certain infections like HIV HBS AG could be transmitted to the child. Hence, we rule out these infections by doing certain tests. If the patient has certain family history, some advanced tests can be advised. For example, in some families or some communities, thalassemia is a very common disorder. So, we need to scan the parents before they plan the pregnancy. Also, the pregnant patient is asked about her rubella antibody status, because if her antibodies are negative, she can be given rubella vaccine so as to prevent the congenital rubella syndrome in the baby in case she is not vaccinated. We always start few tablets which are usually the vitamin tablets, which is called as folic acid tablet for the girl who is willing to become pregnant. It has been proved by research that if we start the folic acid tablet periconceptionally, then the chances of neural tube defect or anencephaly are very low in the pregnancy. We will always give the other options like B12 correction, vitamin D correction if the patient is in deficiency. Also for the husband, if the husband has to be screened for the vitamin deficiencies and about the diabetes status. The viral parameters for the husband has to be screened for HIV HBS AG so that of course the baby will not contract these diseases. Once the couple is counseled properly and adequate folic acid is started around 2 to 3 months periconceptionally, then they can opt for a pregnancy, and with such care definitely the chances of healthy pregnancy are much higher.